Today our topic is the lymphatics of the breast. So we have to study the lymphatics of the breast. This is the breast, the sternum, mammary, sternum, xiphoid process, and the breast. The breast is divided into the four quadrants: upper lateral quadrant, lateral side; upper medial quadrant, lower medial quadrant, and lower lateral quadrant. Now, adjacent to the sternum, there are the lymph nodes. These lymph nodes are named as the internal, mammary lymph nodes. Below the sternum, there is a diaphragm. So, here are the lymph nodes known as the sub-diaphragmatic lymph nodes. Here are the lymph nodes in intercostal space known as the posterior intercostal lymph nodes. There are lymph nodes known as the posterior axillary lymph nodes. There are the lymph nodes known as the anterior axillary lymph nodes. There are lymph nodes known as the central axillary lymph nodes. Here are lymph nodes known as the deltopectoral lymph nodes. The main lymph nodes are here known as the apical group of lymph nodes. Now the lymph from the upper medial quadrant drain into the internal mammary lymph nodes. From the lower medial quadrant drain into the internal mammary lymph node, also some of into the sub-diaphragmatic lymph nodes. From the lower lateral quadrant, the lymph drain into the posterior intercostal lymph node and some of it into the posterior axillary lymph node. From the upper lateral quadrant, the lymph drain into the most lymph anterior axillary lymph nodes and some off into the apical group of lymph node. Then all the lymph from the posterior axillary and the anterior axillary drain into the central axillary lymph node. The central axillary lymph node drain the deltopectoral lymph node, and from deltopectoral it drain into the apical group of lymph node. From this apical group of lymph node, the lymph goes into the subclavian trunk, and from subclavian trunk on the right side to the right side and the left side the thoracic duct and right side at the right lymphatic duct. This is the lymphatic drainage of the breast. Now from the upper medial quadrant, the lymph goes into the internal mammary lymph node at this 20%. From the upper lateral quadrant, the 75% drain to the anterior axillary lymph node. From there, 75% into the anterior axillary lymph node, and some off into the apical group of lymph node. From the lower lateral quadrant, the lymph drain into the anterior axillary plus posterior axillary lymph node, and from the lower medial quadrant, the lymph drain to the internal mammary lymph node and some of it into the sub-diaphragmatic lymph nodes as shown in the figure.